Welcome to Anything Agriculture's Homestead Chickens and how to deal with coccidiosis. As always, like and subscribe for anythingagriculture.com. We have plenty of articles on all sorts of things for your homestead. What's wrong with my chick? When I hear this, I automatically start thinking coccidiosis. One disease that's really common, especially in young chicks, is a disease called coccidiosis. It tends to affect young birds, but it can also affect grown birds. Signs and symptoms of coccidiosis. Lethargy. Birds may appear weak and less active and be huddling together more. They may be having diarrhea or watery or bloody droppings. They may not want to eat or eat at all. If they're larger birds, they have combs and their wattles may look a little pale and they may look a little bit less upright. Your birds may start losing weight and their feathers might be looking ruffled a little bit. And if it's an older bird, your egg production will drop or completely end if you have coccidiosis in your coop. Coccidiosis is particularly dangerous to young birds, although it can and does kill larger birds. It is a very common but deadly parasitic disease that can affect chickens and other poultry. It is a protozoan parasite. This is a microscopic organism that infects the linings of the bird's intestines, causing all sorts of damage. It is an oocyte that is in the environment that infected birds shed, and these will be ingested by birds, and then they wind up living in the intestines and destroying the intestines. The coccidiosis protozoa does spread in the environment due to the oocysts. These cysts are often in contaminated food and water. Wet bedding can create an environment conducive for the spread of these oocytes. This can be exacerbated by high stocking density, which means way too many birds, stress if the birds have been stressed out, or age, usually very young and very old birds. The only way to be absolutely sure that you have coccidiosis is actually by fecal testing or by doing a blood check. And the blood check will check the red blood cells and the total protein levels, and that will determine how much damage is happening into the birds. Most of the time, you should treat coccidiosis if you have an inkling that might be the problem. And like I said, it is very common, so a lot of people treat for it right away. There are several treatment options. A lot of times when you have brand new birds, you can put anticoccidiosis drugs like sementifides into their water or food. This is where you find your medicated feeds a lot of times have these in there to prevent coccidiosis being an issue, especially since we know that it is in the environment and every bird has some spores around them. Also, supportive care, make sure the birds have clean, fresh water at all times. You can also add electrolytes to the water to help the recovery. Nutrients, a well-balanced diet will help most, and isolate birds that are looking ill and sick. You'll also want to look at cleanliness. Everything must be very clean. You must clean the coop or poop out very often. Dry bedding and ventilation to ensure that the humidity levels aren't too high, which can help spread this disease. If a large portion of your flock or your whole flock is not looking very good, it's always good to get a veterinarian consult to see what else can be done. Fecal testing is the only way to make sure coccidiosis is the reason your birds are sick. With bird flu, it's even more important to make sure we are treating the correct disease. With coccidiosis, there is anticoccidial agents like medications that can be put in water or feed, antibiotics to control secondary infections that can happen because of the damage in the intestines, and supportive care, such as making sure your birds are clean and dry and hydrated and not stressed. Clean environment is super important. This is the best way to prevent having any problems with coccidiosis. Medicated feed for a start is also a great way of preventing this problem. If you've ever had coccidiosis before, you will need to use a medicated feed or you will lose birds. Other things are quarantine any new birds that you have for at least 2 weeks before introducing them. Limit visitors to your flock because they can bring it in on their shoes. And foot baths if you've got a large coop or you want to make sure that the risk of contaminated footwear is not an issue, a little bit of bleach in a foot bath before you go in and out of your coop. This is especially important if you have had issues with it. Also, dry bedding is super important. Proper ventilation so we don't have the humidity levels rise, which can cause it to spread, and regular cleaning of the coop and disinfecting the coop and the water regularly to make sure that things are not getting reinfected. The cool thing about coccidiosis is it can be controlled with a lot of really, really good environmental management. That means keeping the bedding dry, ensuring you have proper ventilation, cleaning regularly, disinfecting water in food bowls and waterers. Consider having a probiotic put into the water or feed when you first get birds. That will help reduce the stress, because anytime you get new birds, it's stressful for your flock and for those new birds. Regular health checks are important, and if you've had a serious issue with coccidiosis in the past, remember that you have it in your environment and your birds are going to be exposed. So doing everything in your power to make sure in the environment that those birds are not going to be affected is the best treatment. I hope you found this helpful for your small farm homesteading dreams. And as always, please like and subscribe to Anything Agriculture so I can continue to make content that matter to you.